I think my background has a lot to do with how I fell into this field. I, as a child, struggled a lot with having to have just the basic necessities such as food. We didn't have much growing up. My mom was really young when she had my brother and I. She started at 12 years old, and she had me at 15. And her being the first in her family to move to the States, it was really hard on her. We pretty much were homeless, in South LA. Because she had no one. She literally had no one. It was hard. It was really hard. She found a way to kind of just keep on going. I pretty much idolize her a lot, because she's gone through a lot in her life. Being from South LA gives me the opportunity to help those individuals that kind of struggled the same way I did as a child. So I understand sometimes their anguishness, their stress that they are in, just trying to have both ends meet. That's kind of where we're there for, just to provide that extra support.
So Alex is our social services. I would say he's like the champion of social services. He's ready and willing to help anyone.
We're heading over to our East Compton location. We always have events out in the community to make sure that none of the communities or community members and patients in general go out with any basic necessities such as pads, diapers, wipes for the babies.
I think it's just important to know that a lot of the community members here have had in the past struggles in life. A lot of them come from other countries that they are not really accustomed to reaching out to other people. I think we try to break that barrier, that wall, so they can come over and reach out to, approach our physicians or approach our social workers and be like, hey, I need help. We want to be able to help every single individual that we can. And that's kind of our priority here.
Hey, Miss Ollie, good morning. It's Alex, good in yourself. I will be downstairs waiting for you.
He has an understanding of the community, and he makes sure that, he puts himself in the shoes of people that are in the community, and he knows that they want things that are also going to better themselves, better their lives and their health.
So I'm gonna do a quick assessment with you. I know that we had talked on the phone about, some certain needs that you were looking for as far as maybe housing, food, and utility assistance. So I can provide some information on that, guide you through that process.
I think that the people in our community have that trust with Alex because he's able to be the person that's from the community. So he, works with them on their level, speaks with them on their level, so they have a better understanding and they build that trust with them.
So how did it go with Dr. Meehan last week?
It went well.
Yeah?
Yeah.
Everything came out good?
I love Dr. Meehan. He takes time.
Yeah, he's amazing. I'm gonna go ahead and do a quick pre-screener for our Recipe for Health program so we can go ahead and assist you with food.
Okay. Couldn't ask for nothing better. He is a very nice gentleman, and he's very helpful, and he checks on me. He sit and he listens. That's the main part, and whatever he can help you with, he does that.
So you get a bag of vegetables, a bag of fruit
Okay.
every week, and you set an appointment with me today for next week.
Okay. Oh, this is wonderful. Who can ask for anything more?
Working with Miss Ollie Owens kind of makes my day worth it, right? I think just addressing those needs with her, it just makes it worth, working here at MLK.
Oh, don't need to cry. You'll be fine.
I'm just happy.
My favorite part of the job, is just helping the community, right, that I grew up in. I saw the struggles growing up as a kid, and I want to be able to not see a kid out there and picture myself in that kid, knowing that they have something that they may need. So me being able to provide that to, that child or that whole entire family kind of makes my day rewarding.
So today we're gonna go visit one of our patients who was currently homeless. Said we were able to get her hotel vouchers for her stay. It was her and her 2 kids, a 3-year-old and a 10-year-old. They jumped from shelter to shelter, then back into their vehicle. But she's a new patient that just recently came in through our ED department. So now with her coming in and following up with one of her clinics, we were able to connect her with this organization through our social worker.
Thank you. Oh, I'm about to cry.
You're very welcome. Yeah, that's what you're for. And I know it's kind of hard being a single mother, and it's kind of hard, what you guys went through.
Yeah,
but
right.
if you give yourself time, you'll get to where you want. When I walked in, you get that, flashback to bringing you back. And my mom and I growing up, when she left her recent relationship, she escaped and came to South LA, right? But we had nowhere to stay. She managed to get us into a hotel, something like this.
To be honest, because we were sleeping in the car and I was feeling so suicidal, trying to get into a hotel, being told like, oh, waiting list, you gotta wait. And it's like, or he's too old. And I'm like, to be homeless, he's a kid. I remember going to the doctor a couple of times. And then I think my last visit, I was asking Cynthia, like, do y'all have some type of housing help? Because I'm about to give up. Like, I'm not getting no help. And literally the next day, he placed us here. And I was like, wow, that means a lot to know that people care.
Armin, we have some school supplies for you. So school supplies.
Beyond the walls of our hospital, we make sure to provide that continuum of care that's outside of these walls.
Come on, let's go play. You want to go play? Yeah. Come on.
It was just a flashback, right? I was his age, literally. His age. And to me, just kind of reminded me of that. You can't let this happen to kids, right? You got to be able to help them out, right? No matter what it takes.
Ooh, so what are you going to build? What are you going to make?
You didn't go to school today, Tommy?
We have resources ranging from housing, transportation needs, food needs, all those things. Alex makes sure that he is the person to get the job done and provide those resources to anyone in our health system.
If we have at least one patient that we assist throughout the day, I think that we've accomplished something.